Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
Somewhere in healthcare's development, the human being was fragmented into disparate parts. Now, many patients suffer greatly as countless diseases thrive in the gaps between these parts. Is it time for a worldwide revolution in healthcare? Mission Evolution Radio TV show is coming to you around the world on the Voice of Canada Broadcast Network, www.vocbn.ca. With us this hour to explore revolutionary healthcare options is Amanda Whittal. Amanda is a health psychologist, certified natural health practitioner, and yoga instructor. She's worked as a practitioner, providing holistic therapies and yoga, and as a researcher on a variety of health topics, including patient health, professional communication, stress relief with yoga and meditation, health behavior, rehabilitation, cultural differences, and health policy. She currently works as an associate director in a rare service disease consultancy specializing in health policy with FAIM, the Foundation for Alternative and Integrative Medicine, as European Research Coordinator. Her website, faim.org. Amanda, thanks for joining us on Mission Evolution.
Thank you very much for having me. It's a pleasure.
It's a real pleasure. So tell us a little about yourself, Amanda.
Sure. So I think you did a nice introduction, Gwilda. So it kind of spanned quite a broad range, but from an education perspective, I'm a health psychologist. So I've done a master's and PhD in the field, and really looking from the spectrum of individual health, behavior change, how people can really be empowered to do the small things that have a big difference in terms of lifestyle behaviors, but also understanding the options that are available to them beyond conventional medicine, which has its place, but there is also a lot we can do for ourselves. So my practice, research has all revolved around that core topic.
So what is, you touched into it a little bit, but what is a health psychologist?
I get that question a lot.
I'll bet.
Not very many people know what it is. It's very broad. So in general, a health psychologist is somebody who tries to understand what health behaviors or risk behaviors can either help or harm us as individuals. But we work on an individual and a policy level. So my personal work has been more kind of one-to-one work with individuals, has been mostly along the lines of developing interventions for health promotion or for people with chronic illness to understand what are the barriers that might prevent us from making lifestyle changes that we need, and how can we overcome those barriers through practices of mindfulness, through understanding how we can construct our environment and work things into our lives.
That sounds extremely useful, much needed, because it's like people, they, even if they know what they're supposed to do, sometimes there's something standing between us and taking care of ourselves in the way that we should. That's probably different for each person.
Absolutely. And that's the tricky part, is that it needs to be tailored for everyone. But there are some core things that we can each learn to do so that we understand what our own personal barriers are and what are the things that motivate us to live a better quality of life.
So how can health psychology and health improve the lives of individuals and society?
That's a good question. So on the individual level, it's very much related to what I was talking about. There's a huge component of mindfulness and self-understanding to it. So building those skills for individuals is the main thing that we can do to help people improve their own lives, whether it's battling illness or preventing illness. For society, it's about developing systems that are supportive of such preventative and promotive health approaches rather than waiting until we're further down the line. So that can be anything from designing interventions or handbooks for healthcare facilities to understand how they can bring these skills to patients, to a policy level where we look at how can you integrate things like alternative and complementary medicines, which in many places currently don't have a strong policy structure, but if they did, would be more accessible to more people. So it kind of goes through the individual to the societal level on that trajectory.
So, what do you see as the most common thing that stands between individuals and doing what they need to for their health?
The most common thing is very difficult because, as you mentioned, it is really individual to each person. But there are a few key things. Life gets in the way. We have other obligations that have to come first, whether it's work, kids, paying the bills, all of the kind of immediate life needs, which are all important. But there is the time issue. So, time is always one that comes up. Another one is just a lack of awareness of how you can restructure your environment or your daily living to actually integrate things. So a perception that it's not possible to find a way to fit it into daily life. And a lot of times there's a feeling of just we need to understand that we are worth that effort, that it is something that we need to take care of for ourselves, to empower ourselves to take care of health. And that often stands in the way because that's not necessarily the paradigm that we grew up in.
Yeah, it seems like so many of us have grown up in a paradigm, particularly women, I believe, that says you sacrifice yourself for the children, you sacrifice yourself for the family. You're on the back burner because all these other things are much more important than you are. Do you see that playing out a lot in people's lives?
Yes, I do. I do. And it is geared, I think you see it more in women, but you do see it in everyone in different ways, just different manifestations. And so, really, if you've got that kind of attitude, then you're missing the core belief that you need to actually be willing to invest in yourself to build a better quality of life.
Plus, if you're sacrificing yourself for everybody all the time, eventually there's not going to be anybody to sacrifice because you won't be around, right?
Exactly. And we see a lot of things like burnout on the rise and it's symptoms of sacrificing too much.
Why do you think in this day and age, everything's gotten so fast paced that people don't have time to take care of themselves? I mean, there's all sorts of health clubs, and awareness is becoming higher. What's about these times that is making it so difficult?
Well, it's a question that I'm still trying to ask myself every day. At the same time, I think the answer or the suspicion that keeps coming back to me is we very much are in the information overload age. So many people work at home, but even if they don't, we're constantly connected somehow to things that are going on. And I think this creates a real fast-paced environment, but also a faster-paced environment in ourselves. So we feel like we just can't disconnect. We just don't have time to think about something else. And I've worked with consultancies and people in the corporate world, and this is the pattern I seem to see is this lack of ability to disconnect and really just put our feet on the ground and remember we need to get out of the digital world. We need to take a step back. We need those breaths. We are living beings connected to this earth. I think that we're getting more and more distant from that. And that seems to be a source of a lot of problems.
Do you think that the way the digital world is accelerating, it has a lot to do with it?
I do. I do. I think, we're trying to keep up, but we're also using it. And so it just becomes more and more integrated into our lives with that acceleration as well, which has a lot of advantages, but we need to kind of find that balance where we still see the trees and the air and all of the things that we're connected to and actually made up of.
And that, ground us and are the point, really, aren't they? So
Ex-
increasingly modern healthcare is becoming inefficient to the point that it's being described as broken. What do you see is going on there?
Oof, I guess it depends on the country, but I do see that you see a lot more chronic illnesses these days. So if we were to talk about, say, developed countries, you see a higher prevalence of chronic illnesses. So many more people needing care, many more people needing long-term care, and health systems being either underfunded or understaffed or both. And we've just got a system overload, I would argue, with a lot of things that people could do a lot for themselves. Not everything. We also see rises of cancer and diseases that really need modern medicine. But I think that inefficiency comes with the healthcare systems are also not designed to deal with all of these lifestyle related issues that we're seeing.
And yet, if we, you say cancer needs the medical intervention, but if we intervened and took care of ourselves, are we less likely to have cancer?
Absolutely. And there's also integrative approaches to cancer where you can minimize medical intervention and support with other types of therapies.
The one thing that I've seen, particularly, I'm very interested in alternative and holistic healthcare, in conjunction with what typical Western medicine. But what I find interesting is, your alternative and integrative tend to be less invasive, and yet people will go just backwards instead of starting there and going into the more invasive. They start with the big guns, and then if that isn't working, then they kind of go to the other and expect it to patch up what's damage has been done. Do you see that as a problem, and how can we turn it around?
You were asking all of the questions I've asked myself, but yes, I absolutely see that as a problem. And when I interview different clinics to see what's kind of have a grasp of what's going on in the world, it's an issue that comes up a lot that they wish patients would come to them earlier. And I think it's mostly, again, from our societal habits, our societal paradigms. It's the medical system that we know the best, the conventional medical system. It's what we trust. And going into the unknown, even though it's less invasive, it's got less side effects, not none in some cases, but in general is less hard on the body. It's still an unknown. And I think to make that step, what we see is often people need to become uncomfortable enough to be willing to try something new.
And it's fast backwards, but there you go. So how much does the invasive involvement of insurance companies in healthcare have to do with the deteriorating condition of medical practice?
That's an excellent question. I mean, I do, if it's about the funding and the money issue, I think it does have a lot to do with it. There's not always a support for preventative measures. There's a whole system built around taking care of people when they get sick instead. And it is a part, but it's not the only part. And that right now, all of that really shifts it towards this is the way we have to deal with it. And that's actually not the case. We could alleviate pressure on the health systems, money could be saved, but everyone has to be aligned to that goal.
And therein lies the problem. Everybody has to be on the same page. But I so often hear, someone will say, well, I'm having this and this and this and this. And my doctor can't figure it out. And, you say, well, what about checking with an alternative practitioner or holistic, practitioner or integrative medicine? And they say, oh, my insurance company won't pay for that. End of conversation. So
Yeah.
we've kind of stepped into the victim stance there, haven't we?
Totally. I mean, I don't want to undermine the fact that for some people it's just not financially feasible to pay it themselves. But there is that element, and that there's that element of are you valuing yourself enough to pay for extra healthcare outside of the normal, the conventional? Um, so that's where we're at right now, essentially. That is what we need to accept. And if you want to take control of your health, it will pay off in numbers in the end as well.
Well, it's time for us to take a station break. Amanda and I will return shortly. Don't go away. This is Mission Evolution, www.missionevolution.org. What exactly are the insurance companies insuring? With us this hour discussing the pitfalls of modern healthcare is Amanda Whittal. Her website, faim.org. Amanda, it's interesting to see what is being prioritized by insurance companies. Is it being prioritized because it's what's right for their patients, or is it being prioritized because of the almighty dollar?
I guess the almighty dollar is often the one that rules the world. There's probably a truth to both in the sense that a lot of patients benefit from the healthcare system as it is now. but we're very much missing the complementary, integrative, alternative practices. And that's what I meant at the beginning when I said at the policy level, we look to how can we make those systems more robust so that patients have access, so that insurance companies will fund these treatments. And sometimes they do. I know in different countries in Europe, there is some funding for things like acupuncture. It's not totally comprehensive, but it is a start.
Well, there's so many other modalities out there that really are being shuffled to the side because they aren't in mainstream, and yet it could be the answer to not getting sick in the first place, couldn't it?
Yeah.
So anyone that's been in the system today has probably experienced being shuffled from specialist to specialist with no actual communication between practitioners. What's falling between the cracks in that process?
Well, I think there's a very big tendency. There are some examples of very integrated care practices, but in the most case, we're increasingly seeing specialization in the conventional healthcare and people working in silos. So essentially, you see one specialist, they tell you what they know, but they don't necessarily know what all of the other specialists have done. So you really miss that integrative care and you miss that view of the patient as a whole person. If somebody's looking at your ear, they're not looking at you as a person, they're looking at you as an ear. So that's that kind of fragmentation of the human being is maybe the best way to put it.
Well, there's so many things that are actually system-wide issues versus pieces parts. And are those being missed more frequently because of this approach?
Yeah. Yes, absolutely. There's definitely a lot of area for improvement in our systems to just integrate better, to try to keep information, views. If you take one patient as a whole, that the whole system is able to work with that patient. So there are definitely holes there. I can't say I know how to fill them, but I would agree with your point.
I hear you. So I understand you're currently European Research Coordinator for FAIM. What is FAIM?
FAIM, or FAME, is the Foundation for Alternative and Integrative Medicine. It is a nonprofit organization, been around for several years, and the aim is basically to search the world for effective, accessible, complementary, and integrative medicines, therapies, practitioners, and make this information available to the public worldwide. So it's essentially a resource hub so that people looking for information, looking for alternatives, have a trustworthy source to go to where they can get information for free, because there is so much out there that it can be really hard for people to know where to start.
There's also, a buyer beware factor out there too, isn't there? Because a lot
There,
of the therapies aren't regulated.
that's
So
right.
how do you guys juggle that?
So a big part of what we're doing is the research. So one issue with the alternative and integrative world is that research tends to be underfunded, and that's also part of it's also not regulated necessarily. It's not a priority. But in our work, what we're doing is searching for effective and complementary therapies. So we're looking for the latest state of the art research. We're attending conferences and assessing what's out there that we think is worth bringing to people. We also do, and that's a big part of my job, is we interview people, clinics that we think are doing good quality of work so that we get at least an initial assessment of them. So it's not an official regulation, but it's a quality check on our side.
Right. So if you have standards, people know that you have these standards and can look at what you have endorsed, if you will. Do you endorse people?
Yeah. So we support. We don't officially make any kind of official FAM endorses XYZ, but by putting them on our website and by saying yes, we think that this is something worth knowing, then we endorse it indirectly in that way.
Got it. Got it. So let's back up a little bit for those of us that may not know. What exactly is alternative and integrative medicine?
So the terminology, you'll see various terms in public information. So you might see alternative, you might see complementary, you might see traditional. So those are three interchangeable words. And this essentially refers to natural therapies, more ancient therapies, if you're talking about things like Chinese medicine or Ayurveda, which comes from India. It talks about herbs, sometimes energy therapies, different things like acupuncture, which comes from traditional Chinese medicine, nutritional therapy. So anything that's either natural or stems from a more traditional route that's not integrated into conventional practice. And integrative are practices that really try to bring both worlds together.
So not just bringing the human being together, but bringing all the different practices of the two.
Exactly.
And I find it interesting that they consider Western medicine traditional when indeed the older ones would be considered traditional, right? Yeah,
Indeed.
yeah. So when the when you're working with the alternatives, there's, in my way of thinking, there's four levels to us. There's the physical, mental, emotional, but then there's also the energetic level. How are you finding some of the alternative therapies deal with the energy level of the human being?
Yes, absolutely. They are some of the ones that many people will have the biggest hurdle to accept and understand because it's by nature not very tangible. But things like Reiki, things like bioresonance, these are energetic therapies that are difficult to study, but we have several results from people who have experienced them, who have experienced healing. So yes, that's very much a component of the alternative complementary traditional therapies.
I know that for years now, there's been nurses that practice what they call therapeutic touch, and in hospitals, and the results have been pretty clear. That
Yeah,
that whether it's placebo or not, people feel better, and isn't that what it's about?
the main point.
Yeah.
There's actually hospitals, I can't remember the name, but that will not do surgery now without a person who is experienced in therapeutic touch or Reiki, which is very similar, to basically create that healing space during an operation. So there are effects. They are just harder to study in the ways that we've been used to for the kind of more conventional side of things.
Right. I know in European hospitals for years they've used essential oils versus a lot of other
Right.
things for, for cleaning things up, and, using the natural
Yeah.
instead of the chemical. Is that still a practice? Do you know?
It is. It depends on the country. So some countries are more developed than others. So for example, I'm based in Germany, and here you can go to a doctor, and it's very likely that if you've got an issue, they will prescribe homeopathy. And homeopathy is a vibration-based sugar pill that really works on an energetic basis. And you can get them in pharmacies. So here there is definitely some things that we won't see in other parts of the world. Not every European country has that. Some have kind of not exactly retaliation, but maybe a few steps have taken a few steps back to integrating alternative and complementary medicine. So it's a bit of an evolving field, but yes, there is a lot more of that than I've seen in other parts of the world.
So how old is homeopathy, and where did it originate?
So homeopathy did originate in Germany. I am a very bad with numbers, so I'm not
Good old
going to
Dr.
try to.
Bach, right?
So Bach actually did Bach flower remedies, and homeopathy was Dr. Hahnemann, I believe.
That's right.
And so yes, so they Bach flowers are also energetic, and they work with mostly the human emotions. And homeopathy is basically based on the principle of like cures like, and so they would essentially take the essence of what's causing the illness of somebody. So basically, if you had a plant that mimicked a bee sting or whatever, it would be the essence of that plant that goes into the homeopathy remedy. And the logic behind it is that if your body is exposed to that, it will defend against a bee sting and start to heal quicker. That's a kind of very crude and basic description of it, but that's more or less the principles. And it's very old, but please don't ask me the year because I can't remember off the top of my head.
So it's like the principle is that if you expose the body to a little bit of something, it's not enough to make it toxic, but it's enough to activate its immune system or whatever against what you're trying to defend, right?
Yeah.
Gotcha. Okay. So what do you do as a European research coordinator for FAIM?
So I do a number of things. Mostly, I basically search for clinics, practitioners, therapies that are either new and cutting edge or just really high quality that either we write an article about or we interview or we do we've started doing podcasts. So just to make the information accessible to people. I visit conferences to get a grasp on what's out there. Again, do write-ups, put them on the website so that people can see and be exposed to new and helpful resources. And we're currently developing a platform actually where patients can, or people, you don't have to be a patient, can find any number of conditions and basically see for each condition the number of therapies from the alternative integrative world are useful for that condition and which clinics in the world actually provide those that we've checked. So that's kind of my main work at the moment.
So is that what you have up for an up and coming resource?
Yes, yes.
That sounds fascinating. Is it a what do you call it when it's computer driven? There's a
Uh,
search engine and all that fun stuff going along with it.
so yes, so we've done the manual searches, but it's a search driven in that people can search for their condition, and there's a whole back end to it where it links all of the conditions with the treatments and the clinics that we know of. But it's been done manually by myself and another European resource coordinator because we didn't want AI generated sources. We wanted to be able to go through and check the quality and make sure we knew what was going in there.
So you've done the research hands on, but then you're using the AI to deliver the information.
Yeah, so the
The,
platform will be an interactive online.
fascinating. When do you expect that to be released?
So that should be probably around the third or fourth quarter of this year. So
Oh,
we're
great.
not too long from now. And it should be, hopefully it will be useful for many people. It will be free, so just an accessible resource.
Right. And you can find it on the website that we're giving out for you, right? When the time comes.
When the time comes.
So what is some of your research in this field found?
So my research has been very, very varied. Maybe one of the most interesting things was research I did very early on. I am a mindful therapeutic yoga instructor and holistic practitioner, so I was quite interested in could we do something to show the effects of that. So we did with university students mindfulness-based yoga training for a number of weeks, and it was a RCT, a randomized controlled trial. We had one group of students who did the training, one group who didn't. They were given a kind of a dummy exercise. And we found significant effects in terms of improved sleep quality, decreased stress levels, which is really important. These were students at a private university, really, really focused on their grades.
Well, we're
Um,
going to have to leave this as a little bit of a cliffhanger because it's time for another one of those wonderful station breaks. Amanda and I will be right back to continue our discussion. So you stay right there. This is Mission Evolution, www.missionevolution.org. Are there any alternatives to our broken healthcare system? This is Mission Evolution, missionevolution.org. With us discussing alternative and integrative medicine is Amanda Whittal. Her website, FAIM.org. Amanda, we were just talking about, what were we just talking about? We had to kind of cut you off. Oh, the studies that you were doing around mindfulness practices, and what were the results there?
Yeah, so the results were a mindfulness-based education program with students showed significant effect in terms of improved quality of sleep and decreased stress levels. So this was a small trial, but still basically a nice way to showcase beyond just what we know by experience that yoga, mindfulness, meditation, all of these practices can really help us with our stress levels, which we know stress is very connected to chronic illness and lower quality of life. So that was one very interesting finding.
Absolutely, it is because, like you say, stress is what's taking a lot of us out right now.
Yeah.
So, how do you see alternative and integrative medicine helping the situation we find ourselves in regarding healthcare?
I would say that it is there, and there are a lot of really good practitioners doing really good things, and the field is evolving. So the most useful thing is for people to start using it and to start using it more and earlier. So essentially, if you start using alternative and integrative medicine earlier, you have better chance of preventing the onset of any kind of illness, but you also have the ability to just keep your body stronger and prevent illness in the first place. So that alone would be a huge help for the issue we see in healthcare with systems being overloaded and people not necessarily able to get the help they need when they need it.
And, people hit the system maybe before the system has the tools. In other words, they're starting to feel it. They're sensitive enough. They feel something going on, but it doesn't show up on the machinery yet. So,
Yeah,
yeah,
that's a very
there's that.
good point, actually, is that if people are sensitive enough to notice their symptoms, conventional medicine is probably not going to be able to help you because it's just not designed that way. But if you go to a naturopath or somebody who looks at various aspects of your life, they might recognize, oh, you've got symptoms of adrenal fatigue, but early symptoms. So we're going to do XYZ so you don't end up in adrenal failure, for example.
So once once you've pushed it over the line, if you will, you've ignored these or not known what to do about these symptoms, and then it becomes something that Western medicine does recognize and deal with. Is it like the thing's broken? It's harder to come back from there than it is to prevent it?
It is. It is. Because if you're trying to prevent something, you're only working on one side of it, which is strengthening your system. If you've already had an issue, let's say, for example, a burnout, maybe burnout's a good example. So you've basically pushed yourself past what is normal. Your adrenals are exhausted. You're experiencing things like mental fog, fatigue, depression, etc. Then you have all of those symptoms that you have to deal with first before you can start supporting your body to get back to the normal state, its normal, healthy state. So it is much more difficult.
And the other question is the Western medicine approach of masking symptoms, dealing with the symptoms versus getting at the root cause. How does that differ from the approach, say, for instance, that a holistic practitioner would take?
The main goal of most holistic practitioners is to get to the root cause. And there are aspects that will also deal with symptoms so that you can have some alleviation from symptoms while working on the root cause. But for instance, instead of stopping at the symptoms, there will most of the time, I hesitate always to just say always because it's not always the case, but in the majority of cases, a holistic practitioner will be looking for what caused that in the first place. How can we eradicate it? And it is a different approach. So if you've got, for instance, something like rheumatoid arthritis, which is an autoimmune disease, conventional healthcare has things that effectively treat symptoms and partially treat the cause, but not totally. A holistic practitioner will manage the symptoms because it's quite painful, but at the same time, look for what's causing it, but not just on a biological level, also on a mental, emotional, spiritual level. So, autoimmune disease is very common in the holistic world. Your body is turning on itself. So, what is your mental state towards yourself, and how do you take care of yourself? So, holistic medicine will look at those parts of the causes as well.
And is there any documented studies or whatever that indicate that this is a good approach?
Well, to study holistic medicine broadly is very hard because it's so diverse, but there are studies on particular modalities. So, for example, I guess if you take studies that look at spirituality and people finding a connection and a way to maintain inner peace, there is some evidence on that, that this is good to create a general healing environment within yourself. So, if we stick with the rheumatoid arthritis example, there's a lot of inflammation in the body, and that's exacerbated by stress. And if you're hard on yourself, that is internal stress. So that is exacerbating it. So there are a lot of links, but the studies tend to be separate right now. And that's part of an issue in the field is that we would ideally have more funding, but because it's so holistic, you can't look at one element like you can look at a drug and its effect on one part of the body. So the most of the evidence comes from seeing results, people recovering, this type of thing.
Why is there, holistically speaking, such a increase in autoimmune diseases at this time?
I would argue, just from an experiential point of view, that it does have something to do with the way we treat ourselves, but also our general, let's say, developed world Western lifestyles are not exactly conducive to maintaining a proper alkaline balance in the body. So we've got a lot of things that increase inflammation. We eat a lot of sugar, carbohydrates, we're stressed. There's a whole process that goes on with the body that creates a kind of constant inflammation. And this is probably one of the main reasons that we're seeing so much of it right now.
Our food has been messed with, to say the
To say
least,
the least.
to where there's hardly any food left in it for the most part, if you're not real careful, and shop just in the raw aisles.
Yeah.
Do you think that that is playing a large part?
Absolutely, absolutely. My feeling as a practitioner from that point of view is we're confused. So the food is being changed. A lot of it is packaged, processed, whatever, but it's also advertised as healthy. And if you don't have a nutrition background, some of it is logical. An apple is going to be healthier than a granola bar. But if you're if you receive advertisement that that granola bar has protein in it and it's so good for you, many people will think, okay, I'm doing something good for myself. But meanwhile, there's a lot of preservatives, there's a lot of sugar, and that's kind of the general trend. So I see this as a huge issue, and I see many people unfortunately not eating as well as they could.
Well, we can even look at going into a health food store. People think, oh, if I bought it in the health food store, it's okay, but not so much, right? If you're not
Yeah,
reading your labels.
exactly. Reading your labels and eating whole foods, it seems like such a simple, straightforward answer, but rather than buying snacks that are in a box, buy something fresh, make it, this is going to be 10 times better for you than anything that's advertised as healthy and it comes in a box with a list of ingredients this long.
But there we go back to the time factor. Oh my gosh, you mean I have to spend time in the kitchen? Oh my gosh, you mean I have to cook? I don't have time for that, is what you'll hear a lot.
That's
Well, you can
right.
take time now or you can take a lot of time out later, right?
Exactly.
So, what are some examples of alternative clinics or treatments that you found particularly interesting?
There have been so many, but I can give maybe two different examples that work on two different levels. One is I interviewed, I didn't visit the clinic, but I saw this person. This is Dr. Amit Agarwal. He's a naturopath working in Kenya, and I met him at a conference 1 year ago. He practices naturopathy, but also family constellation therapy. And I was very impressed by this because it's an example of using naturopath, so like mostly homeopathy and nutrition and lifestyle advice to deal with symptoms that people are experiencing. And family constellation therapy looks at your past and how do you release past trauma or past emotional issues that might also be contributing to poor health. So this was absolutely interesting. I had not heard of family constellations therapy before. Um, Another one is a clinic in Germany. They're the Arcadia Praxis Clinic, and it's an integrative oncology clinic. Also extremely interesting because they do use chemotherapy, but in low doses. And the whole environment around that for the patients involves a very comfortable, almost a resort-like visit to stay at their clinic, lifestyle support, nutrition, high dose vitamins. So everything to support the system in conjunction with a lower dose of chemotherapy. And they really know their stuff. They're so supportive. And it was just nice to see that the way they're treating cancer from a very holistic point of view.
What kind of a track record do they have?
In terms of success,
Yes.
so we talked quite qualitatively, but they have seen a lot of success in their patients walking away in remission. I don't know the numbers, but they've been around for quite a while and they've had a lot of successes and they're thriving. So I guess they're doing quite well.
That's fantastic. Where is this clinic?
This clinic is in Germany. It's in a small place near Kassel, but they speak English. They take international patients, so I think it's still worth being aware of.
I said, so why do insurance companies refuse to cover in alternative medicine?
Well, I don't know 100%, but I guess it's just not that lucrative. I think there's not as much money there. There's not as much money as with conventional drugs. So I suppose it is a dollar factor in the end. But not working in the insurance company, I can't say for sure, but that's what I would expect.
Our whole system seems to be designed around drugs and insurance, right? And it seems like they have more control over healthcare than the poor doctors who are overworked and stressed to the max. Do you see alternative healthcare being able to step in and alleviate some of that? We've talked about some of it, but what other
Yeah.
ways do you see that happening?
So I really think there needs to be a paradigm shift for a true change to happen. I do know that a lot of alternative clinics, particularly integrative ones. So at the moment, alternative clinics mostly work on their own, kind of outside of the system for the most part, whereas the integrative ones are trying to basically integrate, as the name suggests, and work with hospitals or clinics that are doing conventional practice to take some of the patients when it's appropriate. So if that's one direction, if you've got patients that are already sick, but maybe they could already be healed or improved just by doing some lifestyle changes or taking some alternative therapies rather than a direct, really intense drug, the ideal would be if that clinic or hospital refers them to the integrative practice. So that's one way of alleviating it. The other way is, again, if people start to go earlier, you prevent a lot of these things from happening in the first place. So that's the kind of societal paradigm shift that maybe we're working towards. I think more and more people are getting interested, more and more people are aware. But that would be where the true value is that we just don't get sick in the first place.
Just change the way we're doing things. Well,
Yeah.
it's time for us to take another station break, but please stay with us as Amanda and I continue to explore the future of healthcare. This is Mission Evolution, www.missionevolution.org. Ultimately, who is in control of your health? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Amanda Whittal. Her website, FAIM.org. Amanda, it seems like we've talked about it a little, but it seems like as a whole, years and years and years ago, a farmer, he wouldn't be going to the doctor all the time, nor would he need to. He was eating raw food, everything was natural. If he got something hurt, he'd go in. But as far as these chronic illnesses, they weren't as prevalent as they are now. And it seems like that, well, the farmer, if he could fix it himself, he would. But we're just like kind of in a victim stance, like turning over our power to a system that's broken. Um, how much of that are you able to address with your association there?
I well, I can't say how far it will go because in terms of who's in control of their health, it's really up to people to take the step. And I guess from a health psychologist point of view, that's where these health behavior comes in, where we really get introspective. We're able to understand, I need to do this for myself and I can do this for myself. Where FAME can support is then we are constantly making new resources available for people and keeping what we had previously. So we're building on our resource base that we try to make as digestible, as understandable. So if somebody wants to take care of their own health, they can find a number of sources of information on the website where they can inform themselves. And then they can see what they can do themselves. They can see if they need an alternative practitioner, because as you said, you don't always need a doctor or a practitioner. A lot of these things just require you informing yourself and taking the step to do it.
And that leads us to another thing is the internet's a wonderful thing, and then it's also a garbage dump. And so, it tends to, oh, we're going to Google our illness and try to figure out what's going on. But how much of what we pull up is actually reliable or useful information? How can we tell the difference?
Mm, the Dr. Google issue. It's it's very difficult, unfortunately. I think it's easy for anyone to get misinformed by something that looks legitimate. The best advice would be to go to sources that have a good reputation. So don't just Google something and go to the first hits you get. Go to designated web pages. So, I mean, FAIM is an example. There are also other web pages. Go directly to clinic web pages. Go to national health sources. I know that a lot of national health sources are still mostly focused on the conventional system, but not all of them are. So that's the best you can do in the internet world, and cross-checking if you've got access to experts.
So, like, say for instance, Mayo Clinic, I think has a website, that sort of thing.
Yeah,
That would
yeah,
be what you'd be talking about. Is if you're looking conventional, and it would be good to cover all your bases, wouldn't it? To see what
absolutely.
conventional has to say about it, see what alternative has to say about it.
Yep,
Yeah, okay.
yeah.
How can the average person find health care they need without breaking the bank?
That's a good question. Again, it depends where we're talking about, I suppose. If the country's got a good healthcare system, um, making sure you've got health insurance is one important thing. I say it depends on the system because I know Switzerland, for example, has health insurance plans where you can add some alternative therapies. So it is worth checking if your country has anything that you can add and adding that so that it's a small payment, but then you at least have access to something like massage therapy, acupuncture, maybe some nutritional therapy, things like that.
Do you think that as individuals, if we stand up and say, this is what we want, if more of us do that, do you think that that's the secret to the change of what the insurance companies will cover?
That's a good question. I think there's absolutely power in numbers, and that, yes, that would have an effect. Clearly, I can't tell the future, but judging from past things that have changed dramatically in our society, it's usually been people standing up and deciding, this is what I want. And I think right now, if we were to do something like that, we would really need that unified voice and people to really understand this is important. I mean, we are facing really a health crisis in many parts of the world. And so to take that back and to say we want those therapies that promote health, that keep us healthy, would be a very powerful step.
Absolutely, it would. So, what does FAIM have to offer people interested in alternatives to mainstream medicine?
So the information that's available lists a number of experts, a number of clinics that are available worldwide. So we don't just focus on North America. We've also got many different countries in the world. So you can look there at the moment for different clinics that are around and explore what we know about them. We've got a big list on the website. More comprehensive will be this platform that I described to you earlier that will become available, because that will really be, you can explore all parts of the world, you can explore all conditions, all treatments, what treatments are good for what conditions. So that will be a very user friendly way to just see what are the options out there for me and what's close to me.
So, what would happen if people around the world would have easy access to high quality information about integrative and complementary medicine? What do you see happening there?
I think there's really the empowerment factor that people would then know enough to know what they can go and do for themselves. As we talked about, there will always be that step of if they want to go and do it for themselves, but that's a personal barrier that we all have to overcome. But having that information, it takes away a little bit of the unknown factor, that uncertainty. Is it worth spending money on? Is it really going to be effective? We're all going to experience it differently, but at least having the information, information is power, knowledge is power. So it basically, I expect, gives people the enough to be able to go out and try different things and see what works for them.
I think that again, so many people are becoming disenchanted with the status quo as far as medical care goes. And hopefully that disenchantment will lead to some action in taking responsibility for ourselves. I mean, isn't that ultimately the only thing that's going to change this is us taking personal responsibility?
Absolutely. And it's a really good point because you see things now that have value, all kinds of electronic monitoring devices that you can have at home and things like that on your watch. You can see if you're active enough. But ultimately, we need to understand ourselves and be able to feel and connect to ourselves to basically understand and explore what do we need for our health right now? Is it just that I'm healthy and I want to feel better? Is it that I'm at risk of some kind of chronic illness that I want to prevent? And we really need to take the responsibility for that and pay attention to what do our bodies tell us? What does our mind tell us? That's really it's the only true way you can go.
Well, when we were talking a little bit about the way it used to be, the farmer would go out, he'd work his field, and the food he was eating was fresh off his field or an animal that he had butchered, and he was active. He was probably drinking water from a well, okay? And we didn't see those chronic illnesses. How much do you think our jobs and occupations and the EMFs we're exposed to in the process, how much does that have to do with the deteriorating state of our health?
I would say a lot, a lot. We touched on diet before, so some if someone is a health conscious person, then they are likely to be eating well and things like that. But there are still, if you're eating anything beyond whole natural foods, there's a question mark how healthy that really is. There's then the fact that many of us, unless you've got an active job, but office workers are spending at least 8 hours a day sitting in front of a computer, surrounded by these EMFs and straining eyes, looking at the screen. So we've got most of us are inside. There are chemicals, and most buildings are not built to be free of all chemicals and give us a very nice environment. So we're constantly exposed to stressors internally and externally. And I think that combined with the stress of the information overload that I mentioned earlier is really hard on our health.
What about the stress of the world condition? I mean, we're not exactly in a peaceful time, are we?
Absolutely. That's a good point. The collective stress, definitely. So whether you're perceptive to it or not, that impacts all of us. There is a general change in the energy in society and people's behaviors that also affect us.
And the feeling safe is not the norm anymore, is it?
No, that's right. So there's a lot of fear, and that's again source of stress, source of inflammation. There you go, more chronic illnesses. There's a kind of unfortunate chain reaction happening a lot of times.
So, what small daily tips have you learned from your research and practice that you offer an audience to promote their health and well being?
Well, I think staying very much with the main theme about empowering yourself for your health is just that we see again and again that there are so many things you can do for yourself that are not a heavy lift, that are it's you can integrate healthy eating into your life successfully if you understand how much time you have. It doesn't have to be loads of time in the kitchen. You can make sure you get enough sleep. There are techniques for actually helping yourself relax. So this research that we did on the mindfulness, this can help you sleep. So taking that time to really integrate small changes, even if you don't get to the stage immediately of finding alternative and complementary therapies or practitioners, just those small things that you do for yourself can make a world of difference.
Well, Amanda, we're just about out of time, and I would be remiss if I didn't ask you, what's your mission?
Well, my personal mission
Yes.
is to support the health of people individually as far as I can in the world. So increasing quality of life. I just feel like if you don't have your health, you don't have anything. And it really is within your control. So my mission is just to reach as many people as possible to empower them to get there.
Well, that's a beautiful mission and so needed in this day and age. My goodness. What's your vision for the future of healthcare?
Ideally, there would be a better functioning conventional healthcare system that's there when we need it in acute traumatic situations, with a solid integration of alternative and complementary therapies that can really support the person as a whole.
Very beautiful. Well, it is that magic moment. Amanda, again, tell us where we can find the information and all your wonderful stuff from the association you're working with.
Thanks, Gwilda. So the website is www.faim.org, and there you can find all kinds of information as well as the upcoming platform in the
I,
later half of this year.
you can bet I'm going to be watching for that upcoming platform. It sounds wonderful. So thank you again for all the work you've put forth to create that and for coming on the show.
Thank you for having me.
My pleasure. And Amanda has been our guest this hour. Her name is Amanda Whittal, a health psychologist, certified natural health practitioner, and European research coordinator with FAIM, the Foundation for Alternative and Integrative Medicine. To find out more about Amanda and FAIM, visit her website, www.faim.org. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. Please be sure to join us again right here on the Voice of Canada Broadcast Network, vocbn.ca, where this mission will continue, bringing you information, resources, and support for our rapidly evolving world.